Hello, my name is Mary Coupland, and welcome to The Road Ahead. Through a series of guests, we are going to help you navigate your own road ahead as you age. We will help you and your parents prepare for your journey. Let's face it, nobody wants to find themselves in a crisis mode simply because they didn't have access to information well in advance. As the publisher of Compass and Clock, we are going to help you achieve your best future. Today, my guest is Todd O'Neill of Home Instead Senior Care right here in Bremerton. Todd and his wife, Lizzie, have owned the franchise since 2015. However, it's been servicing the Gig Harbor, Key Peninsula, and Kitsap County region since 2005. Prior to Todd serving the senior community, he was an area director with Young Life, which is a nonprofit youth Christian organization. He was with them for 19 years. So I guess you could say Todd went from young life to old life in his career transition. He and his wife have 3 daughters and 3 grandchildren, and I am delighted to welcome him to the show today.
Thank you, Mary. I appreciate you inviting me, and thank you for the work that you do with Compass and Clock and for seniors across our county.
Thank you, Todd. So with that said, we're going to jump right into our educational topic today, which is what are in-home care services? So Please educate our viewers on that.
Okay. Happy to be here and happy to help. I know that, as you mentioned, the road ahead sometimes involves crisis, and crisis can sometimes mean care for mom or dad, grandma and grandpa. Could be a spouse, could be yourself, that you live alone and are facing a little bit of just challenges and even being alone, and that's challenging. So we as a company and home care in general allows people to remain independent in their own home, which we think most people want to do. And now your own home could be an independent living community, or it might be your own home that you've been in for 30, 40, 50 years or more, and that is where you want to stay and reside. So in-home care allows a caregiver to come into the home, maybe a little bit, maybe around the clock, and help you with the things that you might need assistance with. That could be simple companionship, it might be dementia and Alzheimer's care, making sure that mom or dad, grandma, grandpa are taken care of and safe in their own home, that they're not wandering. It also could mean that you need help in and out of the shower or bathing, those type of things. Personal care at home. It might be after an injury, it might be after a surgery, and
or
it could just be...
in that case, it might be temporary.
Right.
And in other cases, as you said, it could be
it may be
a
ongoing.
couple of hours a day,
Exactly.
helping mom or dad get out of bed in the morning, dressed for the day, sat down, get the day started with their breakfast.
Exactly. Medication reminders, non-medical type help, which is typically what in-home care is. So it can be companionship, home helper, grocery shopping, meal preparation, medication reminders, that type of thing. And then personal care is more hands-on, helping them in and out of the shower or bathtub or on and off the toilet. These type of things that we sometimes need help with, and that's difficult to ask for. It's painful, and yet it's necessary. And we love to be able to help families remain independent.
Right, and the longer they remain independent, the longer they also have, you let them keep their dignity.
Right.
So that's in-home health services. So what are home health services then?
So home health is typically a shorter period of time where a home health nurse, an RN, would come out to the home, or a licensed physical therapist, for example.
So it's medical.
It's medical, right.
Is it physician directed?
It is, yes. So that medical, that physician-directed service comes out to your home and is typically covered by Medicare.
Okay.
Medicare does not pay for in-home care, but it does pay for, in most cases, or in many cases, some home health needs. So that that registered nurse or that licensed physical therapist could come out at a doctor's order and assist with physical therapy. It could be a bath aid, things like that. Wound care, that type of thing. That is more specialized.
And they can administer medicine.
They can.
Okay.
Yes.
Where an in-home care service can only gently remind you, hey,
Correct.
Elizabeth, don't forget you need to take these 2 pills
Exactly.
at 2 o'clock today.
That's right.
Where a home health aide will come in and say, okay, we're taking our medicine, and they can actually hand it to them.
Right.
Okay.
Exactly.
Now, what is nurse delegation? Because I've heard that term
Right.
also when it comes to helping folks in their home.
Exactly. And good question. And nurse delegation is something that we as a franchise have actually been working on, and others in the home care industry, other agencies, have also expanded to allow some nurse delegation care, which allows us to be delegated under the care of a registered nurse. And there are some home care companies like ourselves that do this already as well. But it is being delegated by a registered nurse who comes out and does an assessment in the home and then works with licensed home care aides.
Okay.
So HCA certification, we'll talk about that I think in a minute more with caregivers, but a home care aide can be nurse delegated. There's an extra layer of training and a certification by the state of Washington that allows somebody to be nurse delegated or be a caregiver that has nurse delegation. So they're working actually in-home care, but under the direction of a nurse.
And a nurse delegate, the nurse delegate herself or himself,
Right.
doesn't come to the home every day.
No.
They come do the assessment from a medical
That's right.
standpoint,
That's right.
and then train a licensed caregiver.
Correct.
Or can they train an unlicensed caregiver, maybe a family loved one, or no?
They cannot.
Okay,
Yeah.
so they train a licensed caregiver.
Right.
And then that licensed caregiver takes over some of those tasks,
Right.
but the nurse delegate comes back to assess on a regular basis.
They
and how
do.
often is that?
They do. The state of Washington requires that that nurse come back and visit, an on-site visit, every 90 days. So that
So once every 90 days?
once every 90 days. And in some cases of, say, insulin and diabetic care, that needs to be more often. So it's stipulated by the registered nurse who does the contracting, the nurse that does the delegation. And not only do they train, but they also verify that the caregiver who is nurse delegated is actually certified with the state and can perform the tasks right there in front of the nurse.
So this is a great bridge then
It is.
between home health and in-home care
Right.
services, so that,
Right.
because let's face it, and we'll get to this topic shortly, about the number of caregivers that are out there, because
Right.
there's a growing need for it.
There is.
So when somebody is in this arena and they're in the need of services, whether it's in-home health care, concierge services, nurse
Right.
delegation, home health, in the in-home care specifically, a nurse delegation, how does insurance play a role in all of this?
Right. Good. Very good question, because the services sound great, but who's going to pay for it, right?
Right, they add up.
In many cases, in-home care is paid for out of pocket. It is private pay. However, there are some long-term care insurance companies, and folks, seniors out there, families that have prepared for that and had long-term care insurance. We work with a number of those. So in some cases, they will cover it. It really depends on the policy. So if you do have long-term care insurance, I would recommend that you read your policy and talk with your broker and find out what is actually covered. You might be scheduling surgery to have a hip replaced or a knee replaced, and you want to find out, if I have in-home care because I'd rather recover at home, what is actually covered and what isn't? And they will tell you. And there's usually an elimination period with long-term care insurance. That means it could be 60 days, 90 days, of you have to have continued care or care days that meet that elimination period. Once that's done, then they will start paying. So it's a little bit like a deductible.
Well, it also sounds to me like with the long-term care insurance that it really would be covering more of the activities of daily living, what we call the ADLs.
That's right.
So the toileting, the hygiene,
Right.
Maybe meals.
Yeah.
Maybe somebody has arthritis and they can't feed themselves. So
Yeah.
I don't know if I'm making this up or what, but I thought like there has
Yeah.
to be 3 ADLs that they need help with in order for insurance to kick in, so to speak,
That's
with
correct.
LTC, long-term care insurance.
And that's important to know your policy and find out is hands-on assistance, HOA, or standby assistance needed with those ADLs, those activities of daily living. And your policy should spell this out exactly what those are. So, but if you had questions, you certainly could reach out to your broker or call a home care agency like ours and ask a few more questions. So,
Great advice.
yeah.
What we haven't touched on yet, and we just have a few more moments, time goes by when we're chatting away. Let's talk about the caregivers.
Yes.
You know,
they're wonderful.
they are.
Caregivers are the gold of what we do. We would not be able to do home care without our caregivers. And they have, as my grandmother would say, hearts as big as all outdoors. So in finding caregivers who really have big hearts, we can help train them. And most in-home care companies can do the training, or someone can go outside of that and find the required training from the state of Washington.
When you say that, you mean, because there's, in my mind, there's at least two types of caregivers. There's the caregivers that work with a licensed bonded agency, and
Correct.
then there's the caregivers that are your loved ones,
That's right.
or your neighbor, or the church. So
That's right.
those folks can go out and get training.
They can. And the state of Washington is one of the only states, certainly I think the only state on the West Coast that says you need training, and you need 75 hours to get your home care aide certification. HCAC is what we call it.
Okay.
A family could hire somebody, a neighbor, friend, to help do the care, but there's liability involved with that.
And taxes too, if you're paying them.
That's
Have
correct.
to cover their
So,
taxes.
and those liabilities exist. When someone hires someone from an agency, they know that they're licensed and bonded, they are trained and screened, vetted, and that gives the family peace of mind, and we love that. So working with families to help the loved one remain independent and cared for with a great big heart caregiver that can also do some of the nurse delegated tasks if they're certified, and all the way from simple companionship to around the clock care, could be end of life hospice care, working alongside hospice in that situation. That's a misnomer too, a little bit, that hospice is out and they will be in the home all the time. They're actually not. They're there to do checks during the week, and they can be called upon at an instant for advice and even a nurse visit. But it's really the in-home caregiver that does provide the care and can be with the client sometimes 24/7. Yeah. So
It's a beautiful thing.
it is. It's great.
So we have run out of time already. I can't believe it. Time flies
Amazing.
when you're
Having
fun and getting educated. Are there any parting words you would like to share with our viewer? Just, 30-second wrap up.
Yeah, I would just say to the viewers out there that if you're wanting to find out more about in-care, call a company like ourselves, call an agency that can give you a quote, talk with you about care for you or for a loved one, and just map it out for you. Typically, there is no cost for that consultation, and happy to come out and share with you what the cost would be and maybe some other options. It might be VA help. It could be long-term care insurance. Navigating those waters is tricky, but we're happy to help. And I'd just say look into it before you have an accident and maybe something that would put you in a hospital, a fall, ask for the help, ask for the care.
Don't wait.
Yeah.
Don't wait until it's too late. Just do the research now,
Yeah.
and
Exactly. Prepare for the road ahead.
Exactly. That's a great way to end it today,
It is.
huh?
It is. Thank you, Mary.
Thank you, Todd, so much. There is more that we can always share, but we do try to keep these episodes short and sweet for you. For today, I just want to say thank you and goodbye. And until next time, have a great day. Bye-bye.